Assalamualaikum warahmatullahi wabarakatuh. Good morning. Today I am going to show you the example of nursing care plan of Miss S. Miss S is a patient with pneumonia. This is a nursing care plan practice, and I hope that you will follow the example of nursing care plan that I am going to show you. So remember, next meeting you will present your NCP based on the case that you've already got with your group members. And remember, record your voice like what I am doing now. Share the PowerPoint to me and I will check your PowerPoint. Next, let me read the case. Miss S. A 4-year-old girl, Miss S, was admitted to the hospital by her mother. Her mother said that Miss S has got high fever for 2 days with chills and tended to sleep a lot, somnolent. She also told to the nurse that Miss S breathes look fast and shallow, shortness of breath, and her body was very weak. The assessment result showed that blood pressure 100 over 60 millimeter mercury, pulse 128 beats per minute, temperature 39.5 degrees Celsius, and respiration 40 breaths per minute. Bronchi breathing was found, hemoglobin 10 gram%, erythrocyte sedimentation rate or ESR 50 millimeter per hour, leukocytes 20,000 millimeter cubic, PaO2 decreased to 60 millimeter mercury, and PCO2 increased to 51 millimeter mercury. Now, let's have a look at the patient's identity. The name is Miss S. She is 4 years old. Assessment. Subjective data. High fever, somnolence, shortness of breath, weakness. Objective data. BP 100 over 60 millimeter mercury, pulse 128 beats per minute, temperature 39.5 degrees Celsius, respiratory rate 40 times per minute, bronchi breathing were found, hemoglobin 10 gram%, ESR 50 millimeter per hour, leukocyte 20,000 millimeter cube, PaO2 60 millimeter mercury, and PCO2 51 millimeter mercury. Data clustering. Number one, we have focus data, problem, and etiology. For focus data, SD, alteration in depth of breathing dyspnea, OD or objective data is tachypnea with air respiratory rate 40 times per minute. Problem, ineffective breathing pattern, and etiology, hyperventilation. Number two, SD, somnolence. OD, hypoxia, PaO2 60 millimeter mercury, hypercapnia, PCO2 51 millimeter mercury. Problem, impaired gas exchange, etiology, ventilation, perfusion imbalance. Number three, SD, fever, weakness, OD, increased body temperature T 39.5 degrees Celsius, increased respiratory rate or RR 40 times per minute, increased pulse rate, pulse 128 beats per minute, decreased blood pressure 100 over 60 millimeter mercury. The problem? Hyperthermia, etiology, biological agent. Nursing diagnosis and problems priority. Number one, ineffective breathing pattern related to hyperventilation. Number two, impaired gas exchange related to ventilation perfusion imbalance. Number three, hyperthermia related to biological agent. Planning outcome and intervention. Number one, diagnosis. Ineffective breathing pattern related to hyperventilation. Expected outcome. After doing nursing implementation for 2 times 24 hours, the client will achieve respiratory status ventilation 0403 as evidenced by indicator respiratory rate, depth of inspiration before and after. Intervention, ventilation assistance 3390. Number one, position to facilitate ventilation or perfusion matching. Good lung down as appropriate. Monitor the effects of position change on oxygenation. Use fan techniques to encourage deep breathing for children. Initiate and maintain supplemental oxygen as prescribed. And monitor respiratory and oxygenation status. Number two, impaired gas exchange related to ventilation perfusion imbalance. Expected outcome, after doing nursing implementation for 2 times 24 hours, the client will achieve respiratory status, gas exchange 0402 as evidenced by the indicator partial pressure of oxygen in arterial blood PaO2 and somnolence. Intervention, respiratory monitoring 3350, monitor rhythm depth and effort of respiration, monitor breathing pattern, and monitor for dyspnea and events that decrease and worsen it. Number three, hyperthermia related to biological agent. After doing nursing implementation for 2 times 24 hours, the client will achieve vital sign 0802 as evidenced by temperature, radial pulse, systolic and diastolic pressure. Intervention, vital signs monitoring 6680, monitor blood pressure, pulse, temperature, and respiratory status as appropriate. Initiate and maintain a continuous temperature monitoring device as appropriate. Monitor respiratory rate and rhythm. Identify possible causes of changes in vital signs. That's all, and I really want you with your groups, please create a good and interactive nursing care plan. Thank you very much. See you. Wassalamualaikum warahmatullahi wabarakatuh.